Welcome to the national webinar on trauma-responsive care, a framework for resilience. Anish Ajibamadazian, Lisa Ojibwe Indigenous, Chimokman Kwe Minwa Anishinaabe Kwe Ndao. I'm Lisa Ojibwe, Anishinaabe from the Ojibwe Nation, and I work within the Infant Toddler Specialist Network. My colleague Shar will introduce herself as well.
Hello, everyone, and welcome to today's webinar. My name is Shar Shank, and I work for the National Center on Tribal Early Childhood Development. Today, we would like to know who is here on the line, so if you could please share in the chat box your name, tribe, Pueblo, Rancheria, Alaska Native Village, or community. We would really appreciate that. And we also have a poll for you today. We would like to know, what is your role in early childhood development? You can choose tribal government, tribal CCDF child care or licensing, tribal early child care and education, state agency staff, such as CCDF, licensing, infant and toddler, training and technical assistance professional, infant early childhood mental health, direct child care servicing practitioners such as child care, Head Start, early Head Start, preschool, home visiting, or teacher, or other. I see we have some poll results coming in. We have some representatives from tribal government. Welcome today. We have some tribal early childhood and education staff. It looks like we have some direct child care servicing practitioners. Welcome today. And we also have a number of state agency staff. Thank you all for participating in our poll. And we are going to move on and talk about our learning objectives for today. Today, participants will be able to identify the impact of adverse childhood experiences and trauma on children, caregivers, and families, recognize the importance of culturally responsive approaches, resources, and supports to build resilience in children, families, and Indigenous communities, explore the implementation of elements of trauma-responsive systems of care. So I am going to pass it off to my colleague Lisa to talk a little bit about the overview of trauma.
So just to note that throughout this presentation, there will be links to resources. At the bottom left of your screen, there's a resource pod which participants can access during the presentation. Also, there are many more within the presentation slides and a resource section at the end, which you'll have access to after the webinar once the slides are posted on the Office of Child Care website. So with that, this overview of trauma is a bit heavy and emotional, but it's needed in order to set the context and purpose as it relates to tribes. And then we'll move into more motivational and positive aspects of culturally responsive strategies, supports, collaboration for comprehensive services, and the trauma responsive care as a framework to strengthen resilience. So tribes are sovereign nations with tribal government systems and early childhood education programs that support children and families, many of whom have been impacted by trauma. So the diverse tribal nations across the country have a shared experience in the historical trauma and intergenerational trauma related to many of the current issues affecting Indigenous communities, families, and children today. So what you see on the screen are the 6 guiding principles for a trauma-informed approach, and pairing this with cultural learning on language revitalization is key to building resilience in Indigenous children and families. For example, according to Vermani and Mangioni's Infant Toddler Caregiving Guide to Culturally Sensitive Care, children who understand their own cultures develop a sense of belonging, personal history, and security in knowing who they are and where their family comes from. Additionally, language revitalization programs and tribal early care and education settings contribute to improvements for children's educational achievement, family involvement, and social connectedness, while fostering children's identity development and sense of self. So we want to give thought as to how the environments, the interactions, and the experiences support culture and language to build resilience, and pairing this with the 6 guiding principles for a trauma-informed approach, which was developed by the CDC and SAMHSA's National Center for Trauma-Informed Care. And their 6 guiding principles, as you can see, are safety, trustworthiness, peer support, collaboration and mutuality, empowerment, voice, and choice, while also acknowledging cultural, historical, and gender challenges in order to be responsive to the needs of children and families that are healing from trauma. So we also have a few definitions that we need to touch on. So there are several different definitions, and we'll start with a few. So at the bottom, you'll see crossover trauma, and that is defined as resulting from a single traumatic event that is devastating enough to last to have long-lasting effects. There's also racial trauma, which includes traumatic events that occur as a result of witnessing or experiencing racism, discrimination, or structural prejudice. And Indigenous people often experience both intentional and unintentional racism. So the unintentional racism is from those who express hate for Indigenous people and or mistake Indigenous people for other ethnicities such as Asian or Latino. And the unintentional racism from people who claim to admire Indigenous people, yet say offensive things based on ignorance, preconceived notions, assumptions, or stereotypes. And at the top, you'll see 2 that are intertwined. Both historical trauma and intergenerational trauma are intertwined with the boarding school era adversely impacting multiple generations, with the last Indian residential boarding school closing in the 1990s. So they were originally based on a prisoner reform model. Parents were required to give up their children or their children would be taken. This resulted in Native children's close familial bonds being severed for several of the generations. There was forced assimilation, an English-only policy that was strictly enforced. There was shaming of culture and language, intimidation, fear, and abusive disciplinary practices were applied. So many of the elders, aunts, uncles, parents, and grandparents are still haunted by what they experienced, and those who survived struggled to cope. So it's important to reflect on the ways in which this historical trauma affects parenting and creates intergenerational trauma. So this definition is from the National Congress of American Indians, and it's specific to Indigenous populations. So it references historical trauma as encompassing the extensive, cumulative, and intergenerational experiences of trauma that Indigenous people have experienced, including land disposition, widespread death through warfare, disease, famine, and forced removal, the assimilative boarding schools, prohibition of religious practices, forced sterilization, and the flooding and dumping of toxic materials onto tribal lands, amongst many others. There's also the definition of individual trauma that comes from SAMHSA. So SAMHSA defines individual trauma as resulting from events and experiences that are physically or emotionally harmful or life-threatening, and that have a lasting adverse effect or effects on the individual's functioning, mental, physical, social-emotional, or spiritual well-being. So these events or adverse childhood experiences may be direct, where a child is a victim, or indirect, where the child is a witness. The events may be scary, dangerous or violent. They may include accidents, death, illness, injury, abuse, or neglect. So additionally, it's important to acknowledge that according to the data from several sources, including Indian Health Services, the Center for Native American Youth, and NICWA, that Indigenous people have disproportionately higher rates of trauma due to several factors, including overrepresentation in foster care, higher rates of poverty, the third highest rate of victimization, disproportionately higher mortality rates from assaults, accidents, and homicide, such as the issue of missing, murdered Indigenous women and children, which has been ongoing, and some states and tribes have begun to work together to address this. And with all of this that Indigenous children and families are experiencing, it's no wonder that suicide is the second leading cause of death in Indigenous people. So clearly there's a need for culturally responsive, trauma-informed approaches, and each of us can contribute our efforts in our roles and professions to provide support and strengthen resilience. So there are a couple other definitions that we wanted to clarify that you'll see on the screen. So with children enduring all of this, either directly or indirectly, or as a secondary traumatic stress, and we just wanted to quickly reference a few of these. So vicarious trauma, secondary traumatic stress, and compassion fatigue. I refer to an individual's exposure to another person who has experienced trauma and the impact of living with, working with, or caring for that person. There are also triggers, which are based on an individual's perception of danger, and they can vary from person to person, and it's what the individual identifies as signals or signs of possible danger. And then one we want to dedicate a bit more time to would be the research on adverse childhood experiences, or ACEs, which has been eye-opening. So the ACEs study included 10 types of childhood trauma that fall into the categories of either abuse, physical, sexual, or emotional abuse, neglect, or household challenges, such as a mother being treated violently, an incarcerated household member, substance abuse, mental illness, such as postpartum depression or PTSD. We have a lot of veterans in Indigenous communities. It could be natural disasters, and something as simple as parental separation or divorce. So the ACEs study found that 36% of adults had 0 adverse childhood experiences, which is wonderful. But this means that 64% of people, so that's more than half, have experienced 1, 2, 3, 4, or more adverse childhood experiences. So this is very common. And we also wanted to differentiate between a trauma-informed and trauma-responsive system of care. So trauma-informed care is a framework based on understanding of the profound effects that trauma has on an individual, such as a child, and recognizing that a person's needs for safety, connections, and ways to manage emotions and impulses are unique. So the trauma-responsive care takes this to another level by being responsive to the individual as a whole and focusing on the fact that trauma is only a part of who they are. And while many organizations are trauma-informed, becoming trauma-responsive means looking at every aspect of the organization or entity's program, environment, culture, language, values, and involving all staff for continuous quality improvement and partnerships to provide comprehensive services. We know that some of the child care programs, they don't always have the means to provide the comprehensive services. But if you're able to partner with different entities within your tribe, between tribes, or even stateside if needed, it makes it possible to provide the comprehensive services and additional supports. So on this slide, and I'll ask Shar to include the link in the chat, There's a video from Harvard University Center for the Developing Child, which you can view after the webinar. It is really helpful as it kind of depicts what children experience physiologically. So children physiologically experience the impact of trauma. So we're going to get into building your knowledge of what you can do about this. So when they're impacting trauma, this video is a good start to kind of give you that visual. So you'll be able to access the link. It's a 2-minute video clip, and it explains and illustrates the physiological impacts on children's development and the body's fight, flight, or freeze response, as well as an increased heart rate and blood pressure and stress hormones when there's prolonged exposure to adverse childhood experiences. So supportive, stable, and responsive relationships with caring adults can prevent or reverse the effects of this stress response. So additionally, another resource that can be very helpful is this compendium of measures of social emotional development screening tools. So tribal early childhood programs could use this resource to decide and determine which of the various social emotional development screening tools would be most appropriate or helpful to them in their program. So social emotional development screenings have been used by Head Start programs for years. They're somewhat new to some of the child care programs or CCDF programs, so often we're asked which tools are social emotional development screening tools. So this gives you a quick reference list. And the purpose of social emotional development screenings, they're utilized by early care and education programs to identify each child's social emotional strengths and challenges. So the results indicate areas where a child may need support. Sometimes the results or score may merit a referral for further evaluation to see if the child qualifies for additional services and supports, such as early intervention or mental health consultation. So this resource, this compendium of screening tools for early childhood social emotional development, it provides a quick reference comparison of all the various social emotional development screening tools for children birth to 5 years old. Some have been culturally validated or culturally adapted for use with diverse populations, but Indigenous populations were not one of the populations involved in the research and validation. So it'd be up to you, your program, your entity, or your tribe to decide if this would be helpful and which one you might like to utilize. So with the child development background knowledge that many of you already have in your profession, supporting children who have been impacted by trauma is important. And all of these pieces are valuable to supporting children in early care and education programs, such as continuity of care for relationship building, emotional attachment, and trust, cultural and linguistic responsiveness to support their identity development and sense of self-worth, emotional literacy to help them express their feelings, as well as routines and predictable patterns to their day. Children that have experienced trauma, they do not like surprises. It is very unsettling. It makes them uneasy. So having a pattern and a routine can be very key and valuable to their stability. Additionally, creating a safe learning environment and using positive guidance, as well as resources such as the Pyramid Model Support Plan, which I'll also ask Shar to put in the chat box. It's also one of the ones listed to the left of your screen in the resource pod. And there is a checklist from the Pyramid Model. So a checklist of early childhood practices that support social emotional development and trauma-informed care, which can be very helpful because some people just want a quick reference checklist to self-assess what they're doing in the classroom and if they're on the right track, so that the checklist can be helpful as well. So giving thought to the child care providers is important. The parents, the teachers, the educators, because there is an impact on caring for children that have been impacted by trauma. So yes, any educator who works directly with children is vulnerable to the effects of compassion fatigue or secondary traumatic stress, being physically, mentally, or emotionally worn out, or feeling overwhelmed by the child or the student's traumas. And all professionals working with traumatized children can learn approaches and strategies to protect themselves from being emotionally overwhelmed by this work. And the ability to support traumatized children depends on our ability to stay emotionally healthy and motivated in difficult situations. So it's also important to recognize any personal trauma that can prevent us from being warm and responsive to a child and being able to work through that. So there's unresponsive care and there's responsive caregiving. So you'll see to the right some examples of unresponsive care where there's occasional inattention, chronic understimulation. It can range all the way to instances of severe neglect in a family context or severe neglect in an institutional setting. To the left, you'll see the more positive, responsive caregiving practices. So the 6 essential program practices for relationship-based care, which we reference a lot. And you'll see it includes culturally responsive care as one of the 6, individualized care, inclusion of children with disabilities, primary care, small groups, and continuity of care, especially for children birth to 3 years old. And in moving from responsive caregiving practices that can be provided in tribal early childhood settings, there's a focus on resilience. So resilience gives us hope, and it's defined as how well an individual or group can withstand and recover from significant changes that threaten stability, capability, or development. And tribal early care and education programs can combine Indigenous knowledge and culturally responsive care with trauma-responsive strategies as a framework to build resilience in children, families, and caregivers, which Shar will talk about next.
Now we're going to talk a little bit about supporting families and caregivers in developing resilience. Dr. Gingrich highlights in his article that at the heart of trauma-informed care is sensitivity to students' past and current adverse experiences and a deeper understanding of why they may be acting out. So how does trauma-responsive practice look in a tribal early childhood system, organization, or program? Trauma-responsive practice realizes the impact of trauma and potential paths for recovery, recognizes signs and symptoms of trauma in families and stress, integrates knowledge about trauma into policies, procedures, and practices, and seeks actively to resist re-traumatization. It is important to support caregivers in implementing trauma-responsive care. You can encourage them in understanding cultural perspectives on collective trauma, grief, and loss, recognizing historical trauma and how it affects decisions or outreach for support, identifying the needs and appropriate supports for children and families impacted by trauma. Acknowledge that culture and language are strength-based approaches to improve resilience. As we talk about building trauma-responsive systems, responsive caregiving for children is key. As we touched on earlier, the difference between the impact of responsive care for young children versus unresponsive care is significant and can change a child's life path. Since we have covered that in great deal in previous webinars, we won't be focusing our time here today. We have heard the risk factors that can result in trauma for young children and their families, Things like food insecurity, living in poverty, lack of social support, previous trauma, and abuse in the home. So what are protective factors? In the context of this webinar, protective factors are strategies that support healthy development of children and families, reducing the risk of children and families' exposure to trauma and helping buffer against the harmful effects of traumatic experiences. Children exist within the context of their families. As we consider how to support families impacted by trauma, we will look at some strategies today that tribes are using: protective factors, environmental approaches, and comprehensive services. Culture is interwoven with traumatic experiences, response, and recovery. Whether it is adding biases to create culturally responsive services or recognizing that intergenerational trauma, working with caregivers who themselves experience trauma, influences the way in which services are provided and received. Culture is a protective factor. Connecting with our community and having social supports are characteristics that build resiliency and assist in recovery. Providing cultural-focused family support services, creating a sense of safety and security within the system, incorporating cultural perspectives and activities within its service delivery. For example, in the past, I worked for a tribe who implemented the Fatherhood and Motherhood is Sacred family engagement training model from the Native American Fatherhood and Families Association, which helped parents devote their best efforts in teaching and raising their children. The curriculum consisted of 12 sessions around understanding relationships, choice, and service. The curriculum offered parents the opportunity to gain deeper understanding of the importance of responsible fatherhood and motherhood as reflected in Indigenous values. Another tribal example is using the Positive Indian Parenting Training from the National Indian Welfare Association. Also, some tribes have the Maternal Infant Early Childhood Home Visiting Program as an additional support in families and caregivers. Incorporating the cultural perspectives of families allows continuous quality improvement in programs. Think about what other mechanisms you can put into place to support cultural practices. Whether parents are applying for child care assistance or searching for child care, they need to be confident that they will be supported by a workforce that understands the impact of trauma. Staff in every part of the system need to be trained in trauma-responsive practices, and the system should promote trust and transparency. When the culture of the system is based on resiliency and healing, there is a much lower risk of re-traumatizing families. One example of this would be parents approach a family caseworker or their child care provider, and they can support in meeting the needs of a family. One program, the Strengthening Families Framework, is an approach based in the identification of 5 protective factors, which include parental resilience, social connections, knowledge of parenting and child development, concrete supports in times of need, and social emotional development. The Strengthening Families is a research-informed approach to increase family strength, enhance child development, and reduce the likelihood of child abuse and neglect. Culture shapes the context for social interactions that form the fundamental building blocks of the various dimensions of identity. Children who understand their own culture develop a sense of belonging, personal history, and security in knowing who they are and where their family comes from. On the screen, you will see a resource for you that you may choose to use. It has been developed by the National Center on Early Childhood Development, Teaching, and Learning. It is called the Making It Work tool. This tool can be used to infuse cultural practices within your current curriculum to support resiliency in the children you're serving. The social-emotional development is at the forefront of developing trauma-responsive care. By utilizing the Making It Work tool, you can infuse cultural practices into the social-emotional learning curriculum. These activities will build the children's sense of identity and belonging, as well as their emotional functioning as they develop relationships with adults and the other children. Children are active learners and take this kind of information, including cultural knowledge and language, through their physical and social experiences. For example, there is a group of teenage hoop dancers from the Red Cliff Band of Ojibwe who are stepping out as young leaders in the community. And it all started in their tribal early child care and education program. The children learned the importance of their family, community, and culture. They developed social relationships while participating in traditional culture, music, dance, and the art of their community. They learned to share, discuss, and compromise as they developed confidence and expressed pride in their accomplishments and culture. This strengthens their resilience, sense of identity, development, and social emotional well-being for positive early learning outcomes. You can access this tool with the link at the bottom of the slide, and I will ask Lisa to also put it into the chat box. But we also have a poll for you. Have you had the opportunity to explore the Making It Work tool? Your choices are, yes, I used it to build our cultural curriculum. Yes, I found it the time to use it. Yes, I would like some additional training. No, but I would really like some training on it. Or no, no thank you. So I'm going to give you a minute to think about that and add your responses into the chat box. I see we have some answers coming in. I see there's a couple of you that used it to build your cultural curriculum. Awesome. And overwhelmingly, no, you've not heard of the Making It Work tool, but you would love some training on that. All right. Give you just another minute, and then we'll close the poll up. Okay. So moving forward, we also want to let you know there are also some protective factors and social emotional benefits in bringing children, parents, and elders closer together through cultural pride in their language. Parents who lost their language through forced assimilation, the boarding school era, or are not fluent in their language still feel involved and valued as they can practice with their children for a multi-generational approach to language revitalization in the home, community, early care, and education environments. On the screen, you will see 4 examples of tribal communities working to revitalize their language. We will put these links to these in the chat box, and you will be able to explore those at your leisure. An environmental approach to promoting resilience in children and families who experience trauma is useful as it recognizes the multiple levels of influence on families' susceptibility to risk factors and strengthening resilience. Cultural and traditional teachings and practices are important protective factors that build strength and resilience and support healthy lives. For example, providing families with the opportunity to attend the Fatherhood and Motherhood Sacred classes. These classes have an environmental support network that provide families with an opportunity to talk through some of their challenges in a safe place. The group also becomes a social network that can help parents stay away from activities that could influence them in going back to some destructive behaviors. Culture is a bond that ties people in tribal communities together. The customs and traditions that people of a tribal community follow, the ceremonies and gatherings and cultural values they adhere to, bind them together and can be utilized to build a system of trauma-responsive care. As we think about early childhood professionals, what are the connection points and ways in which caregivers are supported? We'll focus on the following strategies for supporting caregivers impacted by trauma. Supporting caregivers is important in building that resiliency within your early childhood community. Now we're going to transition into 4 chat boxes. And as you consider your caregivers in your tribal community, how prepared are they to work with children and families impacted by trauma? We have 4 questions on the screen. Right under our cameras, you'll see the community training chat box. And what type of training do you currently provide to caregivers on trauma? The next chat box below that, we would like you to answer what type of training is available in your tribal community through other programs on trauma that can be accessed by caregivers. The third question, what type of training do you provide to non-Native caregivers on culturally responsive practices? And finally, what type of training would you like to provide to caregivers that is not currently provided? We'll take a moment, think about the training available in your tribal community, and type those into the chat boxes. I see we have some answers coming in. We have a few participants typing. Rebecca says there is a whole department called Systems of Care that serves our whole community. That is really great, Rebecca, to have that whole system of care moving on in your community. I also see that in the chat box, when we're talking about non-Native caregivers, Gloria mentioned that there is none at this time, but looking forward to some training in infusing non-caregiver training in their community. Antonia would like to provide education that the community, to educate the community on these issues of trauma-informed care. Also, we have Lauren responding that they refer to community partners for resources. It's really a great idea to leverage the community partners in your community to help with these trainings. A trauma-responsive system is really a community approach. I see Anna responded nation building to assist with non-Native caregivers training. All right, I think we're going to go ahead and close the chat boxes. This activity was really useful to everyone on the line, and we thank you so much for participating in our poll questions. On the screen, you will see a wellness wheel, and this wellness wheel was developed by the Peer Learning and Leadership Network, which is a group of CCDF tribal administrators who work together to build their skills in leadership. And through their work, they developed this wellness wheel to really talk to what is happening in tribal communities and how you can support self-care. It also resembles the medicine wheel. And the medicine wheel can also help you, or this wellness wheel can help you in developing some strategies in taking care of yourself during trying times. As you can see in the white area, physical wellness can represent exercise, nutrition, and health and personal care. Spiritual wellness can represent reflection, empowerment, life and satisfaction, and or fulfillment. In the social emotional section, it can represent family, kinship, friendship, companionship, and culture and community. And the mental wellness can represent continuous learning and growth, sustainability, and career development. So let's take a minute to reflect on the 4 sections of the wheel and think about activities you could participate in this week to heal your own personal stress. Possibly in physical wellness, going for a walk, getting in touch with the earth. In spiritual wellness, participating in a social cultural gathering to gain some support. All right, we're going to move on. Hopefully you can think about some activities that may support your own personal healing as we move through the week. We also want to talk a little bit about mindfulness. Most caregiver training focuses primarily on the content and teaching, overlooking the real social, emotional, and cognitive demands of teaching itself. Luckily, learning and cultivating skills of mindfulness, the ability to stay focused on one's present experiences with non-judgmental awareness, can help caregivers promote the calm.
It looks as though Shar may have lost audio.
It can help caregivers promote the calm, relaxed and live-in classroom environment that children need to learn and promote healing from the exposure to trauma. Mindfulness can also help us be more effective at reducing conflict and developing more positive ways of relating in the classroom, which can help us feel more connected. So with that, I'm going to pass it off to my colleague Lisa to talk about building a trauma responsive system
of care. And we're going to share a few examples from geographically diverse tribes across the country, because you have a lot of choices and different approaches that can be taken. So for example, there's the circles of care model. So interconnecting initiatives to provide comprehensive services to families and the community. There are 61 tribes, such as the Yakama Nation, Standing Rock Sioux, Kickapoo Tribe, 8 Northern Pueblos Council, Mashantucket Pequot Tribe, Page Nation, Tanana Chiefs Conference, Cheyenne River Sioux, and the Muskogee Creek Nation, just to name a few, that implement the Circles of Care model, which is a program through SAMHSA and their Center for Mental Health Services that supports children with severe emotional challenges and their families. So the primary goal of Circles of Care is to focus on local capacity building to improve mental health, substance abuse prevention and wellness services, and supports for children, youth, and families. There's a strong emphasis on cross-system collaboration to include family, youth, and community resources. So thinking about how the Tribal Early Care and Education Program connects with that and how you can work together to create comprehensive services. And there's also a focus on the use of culturally relevant approaches. So the second bullet there, you'll see the Native Connections program, which is also through SAMHSA, and it helps Indigenous communities identify and address the behavioral health needs of Native youth. So there are 148 tribes across 4 cohorts that are implementing the Native Connections program with a focus on reducing suicide behavior and substance abuse amongst Native youth, as well as easing the impacts of mental illness and trauma in tribal communities, because we know it's very challenging. So the Native Connections program provides access to tools, guides, webinars, and resources to assess community readiness, develop strategic action plans, and to support Native youth development efforts, as well as identifying other tribal programs that the family may be eligible for, and to connect the families with needed resources. Within your tribe, it's important to think about all of the different entities that you could also connect with or tap into. So additional comprehensive services and supports can be provided by partnering with other departments or agencies within your tribe or with neighboring tribes. So for example, some tribes like the Hopi Nation and Shoshone Bannock have their own IDEA Part B and Part C early intervention services to support children with special needs. If your tribe does not have that, you could also partner stateside, as they have Part B and Part C of IDEA as well. But if you have it within your tribe, that's wonderful, wonderful opportunity there. There's also the Tribal Human Services Social Service Departments that sometimes can be helpful to families that are struggling to meet their basic needs, especially right now. And then there's the Tribal Health Department and Behavioral Health Services, as well as some tribes connect with the Tribal Department of Justice and Victim Services Unit, tribal education systems and child care subsidies, tribal mental health, the maternal infant early childhood home visiting that Shar referenced earlier often connects beautifully with tribal early care and education. Head Start has been doing home visiting for years, and some of the tribal child care or early care and education programs may look to similar collaboration opportunities. And also connecting with the National Indigenous Women's Resource Center can sometimes be helpful as well. And another example would be there are 11 tribal communities across Minnesota that utilize the Mending the Sacred Hoop domestic violence prevention program. So those are a few examples, and we just want you to give thought to what you have in your area. Also nationally, so expanding comprehensive services by connecting with national entities. So there are many national entities that you might want to connect with, such as right now with COVID-19, the 12 tribal epidemiology centers across the country have a lot of useful information and resources. The National Indian Health Board Behavioral Health Toolkit can be very useful as well. And for tribes that are impacted by opioid addictions, there's the Tribal Opioid Response Toolkits within the National Indian Health Board that you can access online. So along those lines, there's Tribal Health Consortia, there's the Center for American Indian Health with training, resources, and COVID-19 resources specific to tribes, as well as Indian Health Services has multiple divisions and departments, such as the IHS Division of Behavioral Health, IHS Suicide Prevention Program, that you may be able to connect with or tap into. The National American Indian Housing Council for culturally relevant, affordable housing for Native people. As Shar referenced earlier, the Native American Fatherhood and Families Association, NAFA, for their Fatherhood is Sacred and Motherhood is Sacred training model for family engagement. Many tribes have found culturally responsive and very useful, as it has multiple modules. The National Indian Education Association and the National Indian Child Welfare Association, they have trainings and resources and supports that you can access online. as well as the Center for Native American Youth for community-driven solutions, such as youth suicide prevention. We know that in Indigenous communities, with suicide being very prevalent, there are children as young as 10 years old that have attempted suicide. So the need to start thinking about these suicide prevention programs for the youngest age groups is very important. Additionally, the Strong Hearts Native Helpline for Indigenous people affected by domestic violence. It offers immediate peer-to-peer support, crisis intervention, safety planning, and referrals to culturally appropriate resources. So you're thinking locally and you're thinking nationally. And on this slide, we have kind of two images. And we know the font is small, so we'll try to describe it for you. To the right of the slide, you'll see an image similar to Rothenbrenner's ecological systems theory, with the child at the center, surrounded by their family, the community, the tribe, and national level impacts and influence that can either positively or adversely affect a child. And when you think about all of these various levels as you establish or refine a framework for resilience that works for your tribe, department, office, or program, there are some wonderful examples and recommendations from the Putting First Kids First resource, which I believe is in the resource pod to the left, but I will also ask Shar to put it in the chat box. So the recommendations come from the National Congress of American Indians in partnership with NICWA, NIEA, and the National Indian Health Board. And a few that we want to highlight are to the left. So establishing partnerships to make emergency support services available, such as domestic violence and runaway shelters, crisis hotlines, and family counseling programs. The second bullet and the recommendation was to ensure the availability of non-crisis services, such as mediation, anger management programs, peacemaking, and other conflict resolution approaches. The third bullet references supporting the teaching of culture and tradition as a primary means of rejuvenating the self-worth, resilience, and mental health of Indigenous youth. We've tried to reiterate through this training how important cultural and linguistic responsiveness is, especially for Indigenous children and families. So this is an additional piece here cited within this resource. Also, developing parent training programs and child development-focused parenting courses that integrate culturally appropriate child rearing philosophies and practices. When you have a child development background, some of this you've had the chance to learn and study optimal, positive guidance and best practices in working with children. But parents are oftentimes replicating the way that they were raised. And as we referenced with the boarding school era and the intergenerational trauma, sometimes opportunities need to be created for these parenting education classes and the child development knowledge and the culturally appropriate philosophies. So this was another recommendation. Integrating Indigenous healthcare practice into existing health and wellness services. So we've seen that sometimes the elders need a combination of the traditional medical practices as well as Western medical practices for that trust and that confidence, and sometimes creating a balance. So there are recommendations from different entities like the National Indian Health Board to integrate Indigenous healthcare practices into existing health and wellness services. So giving that some thought. And then the last two bullets, interagency agreements for behavioral health professionals to support early care and education programs, such as childcare and Head Start and schools. So as we referenced, with Head Start, sometimes a mental health consultant can come into the classroom and conduct observations and give recommendations either to the teacher or sometimes the parents as to how to address some of the challenging behaviors, or if there's a need for additional supports. So that has been very helpful for Head Start and Early Head Start, and it could be very valuable for the tribal early care and education programs, such as CCDF childcare. And then the last bullet, creating innovative programs. such as partnering with elders for their knowledge and expertise in the language and culture, or partnering with tribal colleges for mutually beneficial internships in which the tribal college students contribute their efforts and innovations to support tribal early care and education programs, while they gain experience or college credits as interns and sharing their early childhood development knowledge. So, such as with the Restorative Teachings Initiative, or for a mentoring program or apprenticeships. And that Restorative Teachings initiative is through the American Indian College Fund. And they have several wonderful examples in which tribal colleges across the country partnered with tribal early care and education programs. So that's another approach and several recommendations that we wanted to share with you. So a trauma responsive system, just reflecting on key pieces, keeping in mind that it recognizes and responds to the impact of traumatic stress on children, caregivers, and service providers by increasing trauma awareness, knowledge, and skills, and incorporating this into the program's policies and practices. And through collaboration to maximize physical and psychological safety and to support the ability of the child and family to thrive. And as you build or refine your trauma responsive system, it's a process. So we just wanted to highlight part of this process is sometimes training on trauma. So we're excited that you're all here for this national webinar. There's more training and resources and collaborations that can be established. Sometimes initiating the collaboration coordination starts with determining other agencies, either within your tribal government system or cross-sector partners to collaborate with, kind of a wish list of who you'd like to connect with, and convening a meeting to determine how to move forward. So for example, reaching out to either your IHS clinic or Head Start agency or local school district or tribal social services agency or other agencies that work directly with the children and families. And then finding that time to see how you both support children and families and ways that there's overlap and ways that you could support each other in a mutually beneficial way to kind of set up the parameters for that collaboration. Conducting cross-sector training between tribal entities can be very interesting and valuable because you have different areas of expertise. So for example, with the Hopi and the Shoshone-Bannock, partnering with their early intervention team and the tribal early care and education team, they each have different areas of expertise that they could exchange. So the early intervention team can train on best practices for supporting infants and toddlers with disabilities that could really help to enhance the programs and services of a tribal early childhood education program. And the tribal early childhood education program staff can then cross-train the early intervention specialists. So there's a lot of different examples where cross-training can be beneficial. Partnering for mental health consultation services. We've referenced a few examples there. Increasing the capacity to provide trauma-responsive childcare, and the process for coordinated services with collaborative partners to meet the needs of children and families. So sometimes you're identifying gaps and you're identifying strengths. What should you continue doing? What's missing and what do you need to do? And then at the end, once you feel you have a beautiful process in place and a trauma-responsive system of care, evaluating the progress. It's this continuous quality improvement cycle as you move forward with trauma-responsive care to build resilience in children and families. And just a few key elements that we wanted to circle back to. At the beginning, we did mention screening for the trauma exposure. So we provided the link to that compendium of measures for social emotional development screening tools. So having a research-based and validated screening tool is one of those key pieces. Making appropriate resources available to children and families. Strengthening the resilience and protective factors. as well as addressing parent and caregiver trauma, providing continuity of care and collaboration across child-serving systems, maintaining an environment of care for staff as well that addresses secondary traumatic stress and increases staff wellness. And Shar will discuss tribal child care implementation across 4 important categories that we wanted to dedicate some time to.
To be truly trauma-informed, the different early childhood agencies must collaborate and work in partnership with local entities and families to design and implement policies that are appropriate and culturally relevant. Specifically, trauma-informed early childhood programs should include high-quality early care and education, the presence of continuity of a nurturing caregiver, environments that promote safety and trust, and an emphasis on teaching social emotional skills, establishing family partnerships, helping caregivers develop cultural competence, and an emphasis on addressing early childhood practitioner stress. So let's discuss questions you can consider on ways your tribal CCDF program could support the development of a system to build trauma-responsive care. In the first column on the screen, you will see some questions to consider around quality initiatives. For example, what quality initiatives has the tribe established that focus on cultural learning and language revitalization to support resilience? An example would be to infuse culture and language into the curriculum used in your local tribal early child care settings, possibly using the Making It Work tool, as we discussed earlier on, to looking at your curriculum and infusing those practices so that children are exposed to cultural practices on a regular basis. Another one is, how does the program provide recognition and appreciation of nurturing and responsive caregivers? Do you promote small group sizes in your development of your CCDF program? Do you have a continuity of care? Do the children in infant and toddler programs stay from the day that they start an early childhood program until they're ready to go to a preschool setting? In the second column, we will talk a little bit about subsidies and child care assistance. So a few questions we would like to consider are, how do tiered payment rates or differential child care payment rates support the vulnerable population equal access to child care? Do you provide a differential rate to caregivers who possibly infuse culture into their curriculum or utilize the cultural language in their day-to-day interactions with children? CCDF programs do have the flexibility to provide those differential rates and to reward providers who are infusing culture into their curriculum. Another question is, what are ways child care assistance can support children and families that have child protective services involvement with trauma-responsive child care? Tribal lead agencies have the flexibility to define child protective services. Within your definition, do you include children who are influenced by the effects of trauma, who have lived trauma or exposed to trauma in their families? You have that flexibility to include that in your definition and possibly reduce co-payments or reduce income guidelines based on those children who are affected by trauma to ensure that they're in carrying trauma-responsive programs for early childhood. The third column focuses on child care licensing and monitoring. How do the established adult to child care ratios support trauma responsive care? Has your tribal lead agency written in their tribal CCDF plan small group child to adult ratios? This is one way that your program could become more trauma responsive. Also, another question to consider are, what are ways tribal child care licensing support trauma responsive care? Are your licensing experts who are going out into the field, are they using supports as they go into families, especially family child care homes? Are they trauma responsive? Are they introducing themselves and doing their licensing visits in a positive way? And the fourth column is professional development systems. What training and professional development opportunities are offered to support trauma responsive care? As we looked in our 4 chat boxes, some of you responded on the type of training that is available in your community. On how does that tie into your tribal CCDF program and ensuring providers are well trained and able to handle and be responsive to children's needs? What resources, trainings, and collaborative supports address early childhood practitioner stress? Do you provide opportunities for practitioners and providers to come together and talk about the challenges that they're facing? Do you promote mindfulness, possibly introducing wellness wheel with your child care providers so that they can do some self-care? And finally, is there a comprehensive trauma-informed professional learning for child care educators in the workforce? Are your non-native providers trained in cultural practices and the importance of cultural practices within their programs? Hopefully this information will be useful to you in developing your trauma responsive system within your community, thinking about partnering with your tribal CCDF program, and really thinking about how you can use the flexibilities within your tribal CCDF plan development to support trauma responsive care in child care. So let's move on and talk a little bit. We have another poll for you, and we're going to transition into the poll. We also want you to think of any questions or reflections you may have. You can type them into the chat box, or you can, and we will answer those as needed. So our first poll question is, how much has your understanding of this topic improved or been supported as a result of this webinar? Has it significantly improved, moderately improved, a little improved, or not improved? Our second question for you today is, how likely are you to use strategies or practices presented today? Already doing a lot of this? Definitely. Will consider, probably not, won't, or not applicable. I see we have some responses coming in. So 45% of you said your understanding has improved significantly today. We're so happy to see that. And 55% of you say it has moderately improved. I'm glad our webinar was useful to you and gained knowledge on trauma responsive care. And we have some votes coming in on how likely you will use strategies. 27% said they're going to consider using some of these strategies, and 63% said definitely they'll be using some of these strategies. And one of you have already started doing some of this, so we're so happy to hear that, that these strategies are useful and that you will be starting to utilize some of them in your community. All right, we're going to change screens now. And we have another question for you. And so the top question is, what topics would you like more information on? We have some choices listed for you to help you decide. Would you be interested in a trauma-responsive care, train the trainer sessions, supporting children in foster care, suicide prevention, opioid abuse and recovery, classroom supports for children affected by trauma, or other? And so if you choose other, we do have a chat box at the bottom of the screen that you can type your answers in. We're going to give you a few moments to start thinking about what kind of topics you would like more information on. I see we had some poll results coming in. We have 17% of respondents would like more information on supporting children in foster care. We have someone interested in opioid abuse and recovery. We have 25% of you interested in trauma-responsive care, train the trainer sessions. And 53% of you would like classroom supports for children affected by trauma. We also have some responses coming into the chat box on other topics of interest. I see Jane has responded both classroom supports and trauma-responsive train the trainer sessions. Also ways to educate and engage parents that are distrustful of child care entities. You bring up a good point, Jane, that there are some distrust in child care entities, and so easing parents in putting their child in child care is really important. Oh, Gloria said try to select 2 options. Sorry about that, Gloria, that we didn't set up the poll that you could select more than one. And she would like more information on classroom supports and suicide prevention. And Lorena would like supports on supporting the child care in children in foster care. Thank you so much for participating in our polls. And we're going to just highlight a few resources before we end our call today. We're going to transition the screen. And we want to remind you there are web links to many of the resources on the left of your screen. You can just click on the resource, it'll turn blue, and then scroll to the bottom, browse to, and it will directly take you to the resources. So just a quick review on some of the resources. We have a resource on preventing and responding to suicide, clusters in American Indian and Alaskan Native communities. All of the links are on the screen. Many of them are to the left of your screen again. A resource on adverse childhood experiences. We have a resource on culture, collaboration, and innovation. How tribal home visiting programs are working to improve outcomes for children, families, and communities. The Tribal Home Visiting Program Video Library. The Intergenerational Historical Trauma Targeted Resource for Tribal Child Care Welfare. Emergencies and National Disasters, Helping Children and Families Cope. After Crisis, How Young Children Heal. Conversations about historical trauma. Behavioral health programs from Indian Health Services. Trauma-informed care trainings and webinars. A resource on historical trauma. Also the Trauma Toolkit from ACF. Mental health promotion resources. Suicide prevention, violence prevention, and substance abuse prevention by SAMHSA. Understanding Child Trauma. Research to Practice Brief for services for families of infants and toddlers experiencing trauma, and several other resources. One we'd like to highlight is Children and Grief During COVID-19 from the Center for American Indian Health, which is really relevant during these trying times, and some additional resources that you can click on the link when you do receive a copy of these PowerPoints. And again, some of these are listed in the web link resource box to the left. So with that, we want to thank you for joining our webinar today. We hope that the information presented has been useful, and if you need any additional support, feel free to reach out to the National Center on Tribal Early Childhood Development or the Infant and Toddler Specialist Network with the State Capacity Building Center. Thank you all and have a great day.